Hi, I'm Ms Cutler, a licensed acupuncturist and holistic health advocate. I'd like to talk about how living with the hepatitis C virus can affect your sex life. In general, our culture does not encourage people to talk about sex. Unfortunately, not talking about sexual problems isolates those who are not satisfied with their sex life and prevents them from taking steps toward improvement. Some with chronic hepatitis C are lucky enough to have normal sexual function and a healthy interest in sex. However, many with the virus experience reduced libido, decreased ability to achieve and maintain an erection or excitement, and diminished satisfaction with sex. Although there have been no large-scale clinical trials proving that the hepatitis C virus directly causes sexual dysfunction, an association between the two is commonly reported. Because it's hard to be in the mood when you are not feeling well, any chronic illness can be associated with sexual problems. Since hepatitis C commonly involves fatigue and depression, a decreased interest in sex commonly follows. Additionally, antiviral medications typically used to battle hepatitis C may cause sexual dysfunction and decreased libido. Besides being a consequence of living with chronic liver disease, depression and anxiety are common side effects of hepatitis C antiviral therapy. To make matters worse, the medications typically prescribed to counter depression and anxiety list sexual dysfunction and loss of desire as a side effect. Finding the courage to speak to your physician about issues in your sex life could lead to a different medication that does not negatively affect libido or hinder your ability to reach orgasm. When the responsible antidepressant or anti-anxiety drugs are discontinued, sexual function typically returns. Another reason that hepatitis C could impair your sex life is because advanced liver disease is often accompanied by a change in sex hormone levels. Because advanced liver disease may lower testosterone and raise estrogen, men with advanced liver disease are more likely to experience testicular dysfunction, gynecomastia, which is enlarged breasts, a female configuration of pubic hair, decreased sexual desire, and erectile dysfunction. Alcohol abuse is known to further lower testosterone levels. Thus, alcoholic men with advanced hepatitis C are especially vulnerable to sexual dysfunction issues. Women with hepatitis C are not immune from sexual problems either. One of the more common sexual complaints with women on hepatitis C antiviral therapy is vaginal dryness, which typically causes decreased sexual interest. Dryness can result in painful intercourse, vaginal irritation, burning, and vaginal itching. Since estrogen levels naturally decline as women reach their menopausal years, this discomfort can be severe in women who no longer menstruate. A topical estrogen and progesterone cream may improve or alleviate vaginal dryness, but oral estrogen supplements should only be taken under a physician's close supervision. Extra care must be taken because estrogen supplementation carries the following risks to women with liver disease. It can worsen jaundice, it can cause cholestasis, which is a condition where the flow of bile from the liver is blocked, and it can worsen liver inflammation. Whether male or female, or on antiviral therapy, living with hepatitis C can lead to sexual dysfunction. Even though it is a subject that most of us prefer to avoid, speaking up about impaired sexual function or interest can prompt a physician to redirect your liver management plan. Those with hepatitis C could experience a decline in sexual function based on liver disease's hormone changes, a consequence of fatigue or depression, or as a side effect of antiviral therapy or other medications. By openly discussing this sensitive topic with a physician, people with hepatitis C can get the help they need to reclaim their sexual health.